I want to thank the ranking member of the Budget Committee. I know he has a lot on his plate, and he and I work well together, and I thank him. I wanted to put in the record my strong support for Congressman Mel Watt to be the director of the Federal Housing Finance Agency. May I do that? Thank you very much. I hope we have a resounding vote for Mel Watt. He is a terrific person. He's got the heart, he's got the intelligence, and he has the experience. And now I'd ask if I could speak as if in morning business the rest of my time.
Without objection.
Mr. President, I am so pleased to be down here with some really good news out of California and how Obamacare, the Affordable Care Act, is working in our great state. People are phoning, people are going online, people are talking with insurance agencies, with health insurance companies. They're getting health care coverage, some for the very first time, many for the first time. It's affordable. All good policies that will be there when they're needed. And yes, we know a small percentage, as the President addressed yesterday, are being told that their old policies are not going to be offered to them anymore. But all of those folks know they can get better policies. They can't be turned away. There'll be competition for their business. Many of them will get subsidies. So I think at the end of the day, this health care story, although quite bumpy, as we know the prescription drug launch was years ago, we know it's bumpy. And we're angry that it's bumpy, both sides of the aisle. But at the end of the day, I think it's going to be good. I want to read to you some of the comments made by people when they send it into Covered California. That's coveredca.com. Here's one who just got an affordable health care policy. Thank you so much, President Obama, and everyone who works there. This was so much easier than I thought it would be. I'm so grateful to get medical insurance. Thank you. Another, great phone support. Thank you. No wait time. The assistant answered all my questions clearly. Another, great job, easy, what's all the fuss about? Another, wow, this was easy, and my monthly premiums are significantly less than my previous employer's health care coverage before the Affordable Care Act. And one who I thought just really summed it up, thank God Almighty, I'm free at last. Now, these are the real people. These aren't the people who have a political agenda. They are real people. They are Democrats. They are Republicans. They are independent voters. They have had a hard time getting health insurance. And because of the Affordable Care Act, with all its glitches on the national website, and we acknowledge them, it's working. It's working in our state, and eventually, once that national website is fixed, it will work for everybody. So I want to put some real numbers on this, Mr. President. 180,000 Californians have begun the process of signing up for coverage. 180,000 families. Imagine the relief that they have. Over 2 million unique visitors have been to coveredca.com. And there have been 200,000 calls to Covered California's call centers. Average wait time is under 4 minutes. And average total call time is less than 16 minutes for Californians enrolling in coverage and asking questions. And we have 4,000 insurance agents and clinic workers trained so far and certified. They have their badges so they can offer in-person help to those who are looking to enroll. I went very recently to a clinic in my home county, and I can tell you the excitement there is palpable. The doctors, the nurses, the assistants, the people in the waiting room, everybody knowing that they can get either insurance on the exchange or insurance through an expanded Medi-Cal program. We have millions of people who will be able to sign up on the exchanges. We have about 1.7 million people who could sign up for the expanded Medi-Cal program. Do I have any time remaining, Mr. President?
5 seconds.
5 seconds. Well, I hope we get these two wonderful nominees on the way to confirmation today, and I hope we'll be patient and all work together to fix the problems with health care, but I think at the end of the day, it's going to be great. Thank you very much.